Polio returns to Venezuela. A young child is reportedly afflicted with polio in Venezuela, the first reported case of the crippling disease since its eradication in the country in 1989. According to the Pan American Health Organization, the child lived in an impoverished indigenous community in the Delta Amacuro state. Poliomyelitis is caused by the poliovirus, which enters through the mouth via contact with contaminated feces or through droplets from a cough or sneeze. The virus multiplies in the small intestine before being carried through the bloodstream to the central nervous system, where it destroys motor neuron cells. According to the CDC, the majority of infected don't get sick, while 1 in 4 develop non-paralytic polio with flu-like symptoms. Paralytic polio, though rare, can lead to muscle pain, paralysis, and even death. In some cases, those who contracted and fully recovered from the disease as kids can develop symptoms years later as adults. Young children, especially those who are malnourished and unvaccinated, are especially susceptible to polio. The disease has no cure, but is preventable through immunization. Venezuela has been plagued with economic and political crises in recent years. Local health authorities, who were supposed to report cases of polio within 24 hours, took more than a month to do so. Call the doctor.
Boy's heart stops after eating a hot dog. A boy who ate a heart-stopping hot dog is the subject of a strikingly odd new medical study. A report in the medical journal Pediatric describes how a 9-year-old boy's heart stopped beating after he began eating a hot dog in Istanbul, Turkey. He was later resuscitated. Choking can lead to cardiac arrest in children, but in this case, medical staff found the hot dog stimulated the boy's vagus nerve, which in turn triggered an abnormal rhythm that caused his heart to stop. Upon further investigation and an electrocardiogram, he was found to have a rare life-threatening heart rhythm condition known as Brugada syndrome. The child was later implanted with a defibrillator to help regulate the abnormal heart rhythms via electrical impulses. The condition is reportedly inherited and more common among those of Southeast Asian descent. Botulism outbreak strikes Northern California. A mother of 3 is lying paralyzed in hospital with her life in the balance after eating contaminated nacho cheese sauce. 33-year-old Lavinia Kelly is one of 5 confirmed cases of botulism linked to patients who ate at the Valley Oak Food and Fuel gas station in Sacramento. Foodborne botulism usually occurs in foods that are improperly stored or prepared. Botulism spores exist in the environment. In the absence of oxygen, the spores grow into bacteria that excrete toxins. According to the World Health Organization, botulism toxins are one of the most lethal substances known. Symptoms usually occur within 12 to 36 hours after exposure, with fatigue, weakness, and vertigo often followed by blurred vision and difficulty speaking. The toxins affect the nervous system and cause paralysis. Vomiting or diarrhea are common, and the disease can cause weakness in the muscles. Lavinia Kelly was driving home on April 21st when she pulled over to the gas station, bought a bag of Doritos, and poured nacho cheese sauce over the chips. The next day, Kelly was admitted to intensive care, where she remains more than 4 weeks later. Officials in Sacramento said there were 4 more potential cases linked to the nacho cheese sauce, which would bring the total to 9. On Tuesday, Kelly's family filed a lawsuit against the gas station for negligence.
Zombie deer disease in humans? A mysterious neurological disease is laying waste to North American deer, and scientists are worried that humans might be next. Since its discovery in 1967, chronic wasting disease has infected deer populations in 24 US states and Canada, and has also been found in South Korea and Norway. Chronic wasting disease is caused by prions, deformed proteins which accumulate in certain organs. Infected deer can live 2 years before symptoms like weight loss, thick saliva, and behavioral changes manifest. The disease is contagious and typically spreads via the saliva and feces of diseased deer, which can contaminate the environment and infect other animals. Prion diseases are typically limited to certain species, but may evolve to overcome the interspecies barrier and infect new hosts. Mad cow disease is one example, with humans contracting the disease from eating cows that have been infected by prions from sheep. While no humans have been infected by CWD, Monkeys in a recent study reportedly contracted the disease after ingesting infected deer meat. Public health officials continue to monitor for any sign of brain-wasting diseases in humans. They have also warned hunters not to consume deer meat without getting it tested, regardless of how healthy the animal looks.
Hepatitis A epidemic hits San Diego. At least 16 people have died and more than 400 have been hospitalized following an outbreak of the deadly Hepatitis A virus in America's finest city. The Hepatitis A virus in San Diego is spread through contact with a fecally contaminated environment, or person to person. It attacks the liver and can be fatal. Roughly 2/3 of those infected are homeless and/or drug users. To combat the spread of the disease, city crews have begun power washing the streets with a bleach solution known to kill the virus. Officials have already set up hand washing stations in areas where the homeless congregate and deployed an additional 40 around the county. Free vaccinations are also available and recommended to anyone frequenting downtown. Hepatitis A vaccines work by prompting the body to produce antibodies against the disease. San Diego's precautionary efforts are modeled after those implemented in Los Angeles, where it proved effective. In addition to street spraying, installing hand-washing stations, and administering vaccines, city officials are also looking into providing more bathroom access downtown.
Dentists keep dying from IPF. CDC doesn't know why. Health officials are trying to figure out why dentists in Virginia have been dying of a rare form of lung disease. Officials have identified 9 dentists, or dental workers, who are diagnosed with idiopathic pulmonary fibrosis, IPF, all of whom were treated at the same specialty clinic in Virginia. Of the 9 cases, 7 have died. Around 200,000 people in the US have IPF at any one time. The CDC found that dental professionals were 23 times more likely to have IPF than the rest of the population. IPF causes scarring of the lungs and can be treated, but not cured. Over time, sufferers have difficulty getting oxygen to the body's vital organs, like the heart and brain. Signs of IPF include shortness of breath, a chronic and dry cough, weight loss, fatigue, joint and muscle pains, and club fingers or toes. Doctors still don't know what causes IPF. Patients usually live 3 to 5 years after being diagnosed.
Toxic shock syndrome explained. In 2012, model Lauren Wasser lost part of her right leg to a rare but potentially life-threatening condition, which she claims came courtesy of her tampon. Toxic shock syndrome is typically associated with menstruating women and is caused by toxins from the Staphylococcus aureus bacteria. TSS is linked with tampon use since the synthetic fibers and high absorbency provide the ideal breeding ground for the bacteria. Symptoms include gastrointestinal distress, a sudden high fever, low blood pressure, a sunburn-like rash, and redness of the eyes, mouth, and throat. Toxic shock progresses rapidly and can lead to kidney failure. Though fatal, it is treatable with antibiotics and fluids if diagnosed early. Another variety of the syndrome is caused by group A Streptococcus bacteria, with those having cuts or burns or having had recent surgery especially at risk. Toxic shock syndrome is rare enough that there is little information on how to prevent the onset of the disease. For now, the best way is to clean any injuries and frequently replace tampons.